Now, I talked about the global perspective of palliative care. And I talked about the international efforts, actually, which work together with the national people in Jordan to implement palliative care. Now, if we stop now and we look behind and we evaluate our experience, we would say our experience is not so much perfect. Yes, we have many good things we have managed to do, but still, palliative care is only limited to KHCC, to King Hussein Cancer Center, where I work. So again, still we have challenges. The palliative care is limited to KHCC. We still have lack of awareness among professionals in the region or in Jordan. So we need to spread the culture of palliative care across the country. And there is another problem with morphine access outside KHCC. But we do have some strengths. We have a model in where I work. We do have palliative care committee. And we do have the culture of the people who actually believe in the spirit of palliative care. And the drugs, most of the essential drugs are available. Narcotics, antipsychotics, antidepressants, etc. And we did have success story of changing the policy of controlling morphine. But still, we need to get more. Well, what we can do so far? We understood, as I said in the beginning, that it was natural efforts which helped us to go ahead and to reach this point. But again, we felt it is our duty as the people in Jordan, again, I would say, to hold the torch and to say thank you for these people. And the best way to say thank you is that they could see that they have efforts which they did in this country didn't go for waste, and that we managed to implement palliative care and to do positive things. Still, it's very challenging, but we always believe that there is challenges, not boundaries, and not borders. And if we believe in teamwork, and we are optimistic and positive enough, we can do something. The last news I would share with you is which happened in last February, when IMRO, East Mediterranean Regional Office, decided to do a palliative care meeting in Jordan, and it was 3 days workshop. And the people came from different Arab countries. And by the end of the meeting, we had agreement that it is time for us to form what we call it Arabic Palliative Care Consortium. And the main goal of that is to share experience and to implement guidelines and to work with international organizations and societies to go ahead and make a strategic plan actually to implement palliative care in our region. As palliative care in Jordan, we worked in that, and we did SWOT analysis, and we found that the main problem we have, and actually we would like to stress in this point, we are talking about many things: changing policies, awareness, drug availability, but we understood that, as businessmen always tell us, we have to put 80% of our work in the thing we think that it will bring us more rewards. And we think this is the point, education. This is the key word. We would like to start with education and having a lobby who would advocate about palliative care. And that will be the key point for success and for pushing things forward. And we need, for this to be done, we need again, implementation. And we need somebody to take over. And that's the time for a society, national society, to take care of all of these things. What happened? After that, Jordan Palliative Care Society was established. And this is the mission of this society is to help healthcare workers to provide high quality of pain and symptoms management for patients with chronic disease by all of this: training, education, drug availability, and creating network for palliative care across the country. And we felt that this is time to start this, and we learned actually, and it's all by coming here and meeting your friends like you guys here. We learned that it is not about workshop for 3 days. It's not giving a presentation for some people who's interested in palliative care. It's just a nice lecture, and the people will forget it, maybe not after 2 days, after 5 minutes. It needs to be implemented as a project. It has to have long-term reflection in real life. And for this to be done, we have to choose the right people, and we have to give them the support, and we have to be with them all the time, because it's a growing and evolving specialty. So we decided to work with family medicine doctors who are available across the country, from north to south, and to give them multiple workshops, and that will be followed by creating a network for palliative care workers. It's not only physicians, nurses, and pharmacists. It has to be a team approach. And this is the way to start. And all this project will be done in collaboration between Jordan Palliative Care Society and the Family Medicine Society, which is actually physicians who are working in Ministry of Health. Again, coming back to this secret or key point, all these efforts cannot be done without national workshop. We need decision makers. We need stockholders. For a long time, we've been talking about that among physicians and nurses, etc. But the real players are not available. We are talking about decision makers in the country, stockholders, deans of medical and nursing schools, media, and politicians. So there is a plan now, by the end of this year, a national plan to have all these people together in a meeting, so that we do a SWOT analysis about palliative care and about pain in Jordan, and come up with a plan, short, intermediate, and long-term plan for implementing palliative care in Jordan. We can see that in countries with a relatively constructed governments, there is a huge need for NGOs who would coordinate all these efforts. So next step we'll do, again, this is a workshop for family physicians and GPs. There is a national pain meeting which will take place next November to discuss pain and palliative care in Jordan. And again, we are planning to conduct the first regional meeting for palliative care, that will be most probably early next year. The conclusion: palliative care is an essential need for patients with chronic disease. Many countries managed to integrate palliative care medicine into healthcare strategy. Jordan WHO Palliative Care Project reflected in creating a center of excellence at KSCC, but still there is a huge need to spread the culture of palliative care across the country. And there is a need to spread the culture of palliative care not only across the country, but also collaborating with regional and international organizations to go ahead. Never doubt that a small group of people committed can change the world. Indeed, it is the only thing that ever has. Thank you so much.